Okay, so we'll be looking at cervical spine examination. So for example, cases like cervical myelopathy. So remember that in such cases, you have to do the examination of both upper limb and lower limbs, right? So lower limb has been covered in another playlist. So in this video, we'll be focusing on what you have to do in the respect to the upper limb. So the first thing that we want to do in a case of a cervical spine pathology would be to assess for the gait. So ask the patient to walk. And two important points in assessing gait. The first is make sure that the patient is walking towards and away from you. And number two, the patient must not be conscious about you observing his gait. So try not to show him that you're actually observing. So we want the patient to walk in three ways. Number one, normal back and forth. Number two, tiptoed. He has to walk tiptoed. Number three, he has to walk on his heels. Because in someone with cervical pathology, so they might present with an unstable gait. Okay, upper motor neuron lesion. So it will be hypertonic, spastic. So they will present with an unstable gait. So usually they won't be able to perform their gait if you ask them to walk tiptoed or on their heels. Okay, so in a case of cervical spine pathology like cervical myelopathy, the patient may present with an ataxic gait, like a broad-based gait or a scissoring gait. Okay, scissoring gait, broad-based gait is something you have to keep in mind, and they would not be able to walk tiptoed or on their heels. So next we look at the Romberg's test. So the most important step in this examination is make sure that the patient's feet are close together, right? Yes. And then you want to just sandwich him between your palms, okay, without contact. And then you ask him to close the eyes. And then you see if he's experiencing any instability. Okay, so he might just sway and just drop off. Okay, so that's what you do. And then we want to have a direct inspection on the cervical region of the neck. So you ask the patient to sit down. Okay, then we inspect for the neck. So this is our area of interest. So what do we inspect for? Look for any deformity, swelling, sinus discharge. Okay, that could be suggestive for any infection like osteomyelitis or TB spine, Pott's disease. Okay, and then we want to look for any cafe au lait spots. Okay, that's something you can get in neurofibromatosis as well. And you want to look at the lumbar region for any tuft of hair, indicative of spina bifida. So then we move to the, so look, feel, move, special test. Next you move to the feel or palpation.